do when a client is checking in with themselves and gets a persistent feeling of, I don't know? There's a lot of nuance to this. So let's get into it. Yeah. I mean, there are a number of different things I do, and it is part of why I bring, like, instead of practicing IRF, I practice SIRF. So I feel like there's a number of ways we can come at the question. One is that when someone is saying, I don't know, we might be getting a sense of, like, what kind of I don't know is it? Is it I'm really having a very low awareness inside? Or is it I'm really confused, I don't know? Like you can literally see, like, the person looks confused. Is it, those are two biggies, right? Of like low interoceptive awareness, and the person is literally saying, they might be even saying, I don't know what to focus on in here. Like, what's important, what's not important. I can tell you about the pain I have in my knee, but, like, I don't know if that's important. And so sometimes a lot of times people don't know what to tell you about, and they have a dismissive relationship to what they encounter inside. Kind of dismissing everything. None of this feels important. And they're not used to, because who is tracking the body? Like, tracking the body is a weird thing to do. And most people, that's not what we normally do. And so while we might be able to learn to do it for ourselves when we're introducing it to our clients, they often are like, I don't think you want to know about this. But we actually do. Because even though we don't initially know, is this a meaningful bodily sensation or just a bodily sensation? Person often can't tell us initially whether this is something they're feeling right now or something they often or usually feel that they're telling us about. Like, we're almost, I think of it like I forget which, I think it might have been, it wasn't Winnicott, it was maybe Fairbairn, or a different one whose name I can't think of right now, who talked about psychoanalysis like being a bird parent who, like, chews up the worms and puts the worms in the baby bird's mouth. It's a little bit like that, where when we are teaching a non-focuser client to focus, so to bring focusing into their treatment, and they don't have the benefit of a class, it's a call and response learning. So, like, we ask, they answer, we ask, they answer, because they don't have the benefit of a class to say, this is what you're looking at, this is what you're looking for. So it's sort of like, for example, you might say, oh, you've been talking about your relationship. Maybe take a moment, sense what you feel inside as you're talking about it. I feel agitated. And they literally lean forward, eyes open. Say, oh, agitated. So you're really sensing some agitation in here. You might want to see if you'd like to go back inside and take all the time you like with that feeling of agitation. Would you like to do that? And so we're all almost like excessively invitational, like describe it. Just see if you'd like to. So we describe it, and then we invite again. And I have taught many, many people to focus in this way, where they literally stay in for 5 seconds, and then 30 seconds, and then a minute and a half. And pretty soon they're inside for 20 or 25 minutes. And so, and it's the recognition that this is normal. This is a normal way to learn focusing with a client. Is they don't even need a question in order to want to be in an interpersonal exchange with you, because they are expecting, for those of us who do talk types of things, they're expecting to be in an interpersonal interaction with us. And so the growing capacity to be with you, but not in constant interaction with you, is a learning and a capacity thing because they feel like they're doing something like that's weird. I'm with you, but my eyes are closed, or I'm sensing inside. I'm not talking to you about it for a minute or two at a time. And then I'm letting you know what I'm sensing. And it's just this is a very different kind of conversation than you've probably been having. With someone with low interoceptive awareness, first of all, that often feels like low interoceptive awareness, but it's actually not. That's someone who actually readily learns with support to go inside and let you know what they're experiencing. And in my experience, both in my 10 years of teaching SE and my now 5 years of teaching IRF, most people who say they can't feel anything inside fall into that category. They actually do feel inside, but they don't actually know what to tell you about or how, and they don't know how to stay with it. And then you have people who truly have low interoceptive awareness. There's very, very low feeling inside. Now there, I do kind of lean on my SE. And how do I do that? I do it by using what we call in SE the B of behavior. And so posture, gesture, expression, and the I of image, the use of external images like the smell of perfume, the feel of the texture of your clothing or your skin, your visual, like all your senses. When we use movement and the senses to produce sensation, and then we support someone to tell us about it. So you're actually, creating the scenario that you then ask them to report on. And that is also just it's like an entrainment of, this is what I'm looking for. This is what I'm going to help you to experience. And then it's just being like calm and confident, like the more calm and confident you are, the more kind of normal what you're asking for seems. And the more confident they are that they can actually experience it. Because when we're feeling like, do you feel anything? Like they're like, I don't know, but the more we say, okay. So as you look at that tree outside the window, maybe just take a moment and sense what happens in your body. It's very kind of flat in in that register that's just like you're just going to sense this. And then the person does stay a little longer than they might have. Their anxiousness doesn't pop them out quite as quick because you're kind of inviting in that spacious way. Just stay with that. As you notice something, you might let me know. Take your time. And so you're adding in all those, they're actually suggestions. Take your time. That's a suggestion. But we do it all the time because we want them to take their time, not to just sense it and, come out. Sense it in a spacious way. Kind of get that it's not necessarily going to be there immediately upon your putting your attention to something. Sometimes it's like you bring the attention, the wheels turn slowly, and then the person is like, I don't know if this is related, but, and often you'll get sort of these like, I'm not sure. I'm not sure. And the I'm not sure isn't even formed into I'm not sure if this is what you want. I'm not sure if I even feel this. I'm not sure if this is actually here. And you're just supporting them of like, go with that like it's like you are sure. Go with that like you're sensing you're sensing a little bit of something, or you're maybe sensing something. You're sensing something there. It's just said in the affirmative. And that helps you move forward each step of the way to someone building confidence that what they're encountering is a real thing. And I do reflect back things that I normally reflect back. And you exhale. and your shoulders drop a bit, and something seems more relaxed. The more we reflect the B of the behavior, the more it brings something into someone's awareness and the more they feel it. Because a lot of times we really don't, we do those big sigh breaths and we really don't even notice that we do it. You know, you start to notice that you do it, but you can probably do it a bunch of times without even really having it in your awareness because you're occupied by something else inside. So when your practitioner reflects it back to you, it's like, oh, yeah, I did just. And so when the practitioner says, and you might notice what that's like, oh, something in me does feel a little bit different. You start to register things that weren't really registering before. And so it is kind of a learning that you're supporting the increasing experience of interoception. And then I think it's about like people expect it's going to happen faster and more deeply than it generally does. Like it's like at first it's just like, oh yeah, I'm tense. Or I feel kind of sick inside. Like they'll tell you something like it's an end point, you know, end of story. And that makes sense. And then we might reflect it back like, oh yeah, you're really noticing that. Like something's feeling kind of sick inside. Would it be okay to spend another minute with it, just kind of sensing it? Maybe you could just acknowledge inside that you feel that. Now, that's just a tiny variation on what I teach you in IRF. It's a more normal conversation version of say hello to that. And so I think of it as like this is the mid steps that people need to not set off the what kind of response. What do you mean say hello to it? What do you mean take a moment and acknowledge it? Just you might just acknowledge inside that you're aware of that. Like it's just the same thing with a few different turn of phrase. Yeah, it's so hard for me because like I literally have done hundreds of demos with people who literally write to me, I have no feelings inside. And I have almost never not had something happen in a demo. Something always happens. And so part of me feels like it's about sustained attention. It's about creating experiences in order to feel them right now. Not, you know, expecting the experience to be there in order to encounter, but pivoting when someone encounters nothing to, you know, not exactly, but okay, pinch yourself. Did you feel it? You know, it's kind of like that. You know, it's like, oh, okay, you're really noticing that it feels when empty is actually a feeling. So I almost don't want to say empty because empty is like, that's a real thing. Numb is a real thing. Those are real feelings. So you can track those. Person just needs help and support to track the, where do you feel the most empty? Where do you feel the least empty? I do think that you are right, though, that people who I have worked with who have the most almost like no, as far as the no, there's nothing in here, really, nothing really. Get out of here. Have been endurance athletes. And I worked with a ballet dancer who was highly trained to like not feel her experience, otherwise she wouldn't be able to do what she did. And it did require like a lot of sustained attention in a number of areas, mostly recognizing like almost like we took some things off the table. It was like, all right, I really don't want to feel my feet because I have to go to work tomorrow. I have to go to a 3-hour practice tomorrow. And I don't want to be aware. of the pain that I'm having in my feet. Okay, so let's not go to your feet. Maybe let's start with, where would you like to start? Would you like to start with your hands? Okay. And so it's a suggestion of like bringing the attentional network to some place that feels neutral, and then doing something with the, like, we're going to go to the hand. Now do something with the hand. Move your hand. Look at your hand as you move it. What do you notice as you look at it? As you look at it, what do you see? What do you feel inside? It's an entrainment of you're doing something, and what do you feel, even in terms of preference. Like, oh, does it feel pleasant, unpleasant? Starting like that's like almost an identity issue when someone has trouble saying, oh yeah, I kind of like how it feels to move my hand. Oh, and now we're going to circle the wrists just on your left side, not on your right. Circle your wrists, circle your elbow, back and forth, circle your shoulder. Now notice your left side. Tell me about it. And now notice your right side. Tell me about the difference between the two. It's literally producing a feeling and then asking someone to tell you about it, and even suggesting if a person still has trouble, which one feels better to you, the left or the right? Oh, the left, the one that moved actually feels quite a lot better. So let's notice that. Whatever it is, of that is, it's a perfectly, I think of it as I'm using the B of behavior to produce a sensation and then tracking the sensation, knowing that pretty soon someone's going to come in and just start talking to me about their sensations. And I'm going to be like, wow, okay, now you got it. Now, you have something there. And at the same time, I really want to acknowledge that there are people who have tremendous experience and training to ignore what they're feeling inside. And the I don't want to is still a good thing to track. Like the person who, like I worked with, who was a ballerina and was like, I don't want to feel this. That's a lot of pain, and it takes a lot for me to not pay attention to that, and I need to support that. All right, let's notice how you support it, what it's like, and let's put a lot of attention to areas that are feeling more pleasant than that. And it is nice when we can focus on something that feels pleasant. Because why do people want to leave their bodies in the first place? Because it's not feeling so good. And so when we can direct the attentional network to some place that's feeling relatively okay, it's kind of like saying, the water's fine, come on in, like instead of like, oh yeah, we just put your attention on something and it really does suck and it's in pain and you can describe that, but like, okay, now get me back out to where I was, where I couldn't feel it and I was numb and I was better off before you started. So we want to recognize there are people who really can't, and there are also people who get worse when they pay attention to their sensations. For people who get worse, often there's like these couplings, like I can feel it, but oh my God, it's terrifying to me. I'm like, okay, now how do we make it stop? We're going to work with that of like, feel that and then feel the fear. But I actually would back out of the body with a person like that. I'm not going to go straight in. It's almost like going too central to something that's in distress. And I'm going to work outside the body for a while until things get a little more, stabilized. That's right, that you're building from bodily sensation to meaningful bodily sensation.
Okay.
And that the staying with almost invariably produces something else. And even if you're with the sensation in someone's knees, at some point they're going to say, I don't know if this is relevant, but I'm remembering. Okay, yes, we don't need to worry about whether it's relevant or not. Maybe just share the memory. You're remembering. My mind is wandering, and I'm going to maybe take a moment and just say it out loud. And so you're letting someone know that even their reveries, which in a somatic experiencing world is your images, that reverie that happens maybe because the person is like maybe a little more relaxed or something is, moving, and their reverie happens, and people mostly will say, I don't think this is what you want. My mind kind of wandered and this happened. Well, maybe let's treat it as though it is relevant. You could just describe it in a sentence or two. You had an image, you had a memory, you had a reverie, a fantasy. Great. You're letting them know that whatever occurs within the space of the focusing is treated as relevant until it somehow shows itself to not be relevant. You're going to trace and track it. Something more will come at some point. A theme or a progression starts to emerge, and you're just supporting that. Oh, and now this is here, and now that's here. And it builds like one little block to another starts to build.